of the questions that a lot of my patients ask me is, what is a floater? And so I have this video of a patient that has a floater and I wanted to show it to you. But first I wanted to tell you what a floater is. The back of your eye, the back 2/3 of your eye, kind of this whole hollow part of the eyeball is made up of a gel called the vitreous. And that gel is kind of like jello. So if you take a plate and you shake it and the jello wiggles all over, that's kind of like the gel inside of your eye. As you move your eye, that gel inside of your eye is moving all over. And as we get older, the gel is made up of different fibers and they kind of stick together a little bit. And so as we move the eye, some of those that are stuck together, you see them as a spot out there. We call them a floater because as you move your eye around, they move. And so I took this video of a patient that has floaters, and you can actually see before I play the video, this is her upper lid and her lower lid. This is her dilated pupil. This is my white light showing in, and you can see these little white dots. Those are actually her floaters. And so what happens is as she moves her eye, you can see these floaters starting to move. And I asked her to turn her head real fast or her eye to the left, to the right. And as I did that, you can actually see the floaters inside move. They're totally harmless. They don't hurt her at all. They won't cause any problems to her vision or anything like that. And there really is nothing to be done with those floaters. Eventually, the gel inside of our eye kind of starts to fall down to the bottom of the eye as we get older, and it doesn't cause any problems to the floaters don't cause any problems to the vision, but unfortunately there's not any drops to fix them. There are some side effects that if you get a lot of floaters, if it's a floater that you're seeing for the first time, please come in and let us look at it just to make sure it's not a retinal detachment, because that floaters can be a sign of that. But once we tell you they're harmless, they're just something you kind of put up with.